And you also talk about value-based healthcare. Now, from where I understand, value-based healthcare theoretically is healthcare where you pay after the value has been given. What is value-based healthcare for you? I mean, as an example, in the education sector right now, we are going through this change where instead of paying for the education, for the service, you end up paying for the placement. So you take the service, and once you get placed, that is when you end up paying the fees.
Yeah.
So it's basically more outcome driven, and it naturally puts everybody's incentives, aligns everybody's incentives in a manner where everybody is now working towards the outcome and not just focusing on getting done with the service.
That iPad, you knew exactly how much it was going to cost when you bought it.
Correct.
You knew exactly what you're going to get, what you expected, and you know exactly what you're going to use it for, what features it can deliver, what features it can't deliver. The act of buying the iPad is something you looked forward to. It was something you saved money for, you saved time, you waited for the latest model with M2 processor or whatever that is, and you said, fine, this is a purchase, I'm planned, there's transparency, I know exactly what I want, and I'm happy paying this money. Same for your holiday, same for going to eat in a fancy restaurant, same for watching a movie in a 3D IMAX studio. These are experiences that people pay for where everything is known beforehand and they're looking forward to the experience. Healthcare does not work that way because you end up coming when it's really bad. You don't know when you come. It's unplanned. You don't know how much it's going to cost. We don't know how much it's going to cost. And we may give an estimate and the final number may be wildly off the mark.
Correct.
Everyone is unhappy in that situation.
Correct.
Our customers, the patients are unhappy in that situation because this is something they never wanted to happen. Nobody said, this is the day I shall have my cancer and I look forward to spending lakhs of rupees to take care of it. It's not a welcome experience for any of them. It's not welcome for the hospital either. Because while we would love to be able to see exactly, you will be out in 3 days. Cancer doesn't listen to that part. It does what it wants. We don't know exactly how long you're going to be with us. So we won't know how to plan because there are so many other patients waiting. So we're blocking capacity for this person. And then if they don't get out in time, then you're cascading the delay to the next patient and so on and so on. The whole organization is built around that. So with value-based care, we said, let's flip this. Let's say you didn't have to think about health as only this thing that you do when you're sick or when it's bad. What if you just paid us an amount every month? A steady amount. And we tell you in advance how much that amount needs to be. And in exchange for that, everything else is covered. Healthcare as a subscription, if you want to call it that, or bundled care, or integrated care, or value-based care. It has hundreds of names, but it all means the same thing. You contract with the provider, which is us, and say, fine, you are the guardian of my health now. Your job is to take care of everything. I'm going to pay you this amount of money every month for as long as I live. No matter what happens, if it is health or health adjacent, you're the one. Is it medicines? Take care of it. So home visits, appointments, take care of it. Any surgery required, take care of it. Any cancer that's required, you take care of it. It's not a new model. These things exist in the US. There's Kaiser, there's Intermountain. There are a lot of agencies that do that in Brazil. There are cooperative health institutions.
How is this different from insurance?
Insurance, health insurance in India is like a credit card. You take over, you pay for. That says, you have a 10 lakh spending limit, but when you go and swipe it and then you purchase something, actually it turns out that it only swiped for 5 and the other 5 you have to pay for. It works sometimes, it doesn't work sometimes, and sometimes it'll actually say, no, I'm going to not work today. It's very variable. It's not very well designed as a construct. It is health insurance in India is something that's very distributor driven. It's driven a lot by this push driven marketing where people come and they say, this is the thing, you make a lot of tall promises and you put one big asterisk over there and the list of things it does not do is printed so small and you never know about it until the day you get admitted. Maybe people just don't want to know. I don't know anyone who reads terms and conditions. I don't read any of the software T's and C's. I don't read anything when I download an app or when I buy any other sort of policies. So it's not well designed. So we had to redesign it a lot. But to do that required a lot of change from our side.
So according to you, value-based care is care where you don't have to pay a variable amount and leave it up to the hospital or the doctors as to how much you would be charged. You pay something every month, and in return, the organization makes sure that anything and everything that comes and affects your health is taken care of. And there's no extra charge.
I mean, there will be some extra charges. That depends on the T's and C's. But by and large, we want all of this to come as a series of bundled payments. Rather than right now, how people think of healthcare, this very episodic thing. Nothing. The spend will go like 0, 0, 0, 0, 100 rupees medicine, 0, 0, 0, 500 rupees some appointment, 0, 0, 0, 1,000 rupees one test, 0, 0, 0, 10 lakh rupees something really bad happened, then 0, 0, 0, 0, some major event, and then you're dead.
Correct. This is very similar to the model that you described earlier as to how people pay as they age. So there's some spend when they're born, and then something in their late 30s, 60s, a lot of spend in their 80s, and then they're dead.
Yeah. So what does that do? It misaligns the incentives. So a surgeon doesn't care what happens to you after surgery. The physician doesn't care what happens to you when you're sitting at home. The pharmacist is not thinking about, are you out of medicine? Because they're expecting you to drive the demand.
Correct.
No one is health seeking.
Correct.
In that way. And no one is talking about prevention. In our system at least. There are outside people. There are, the entire ecosystem of nutritionists, people that run gyms and, fitness experts who are worried about that over a holistic aspect, but they're not connected to the main healthcare ecosystem. So two of us are living in two separate bubbles. None of us are worried about prevention. None of us are telling people to get their scans done on time. None of us are telling women to get the mammogram at age 40. None of us are telling people to get adult vaccinations.
So insurance and healthcare being managed by the same entity blows my mind for a variety of reasons. You also mentioned Indigo, which works on razor-thin margins. So they have to achieve operational excellence. In your case, outcomes are often not in your control. In our case, for example, in mental health, 90% people will get better, say with a care that's costing us about 30,000 rupees or 20,000 rupees.
Yeah.
The rest 10% people who don't get better, you need to spend lakhs because of the kind of conditions they have.
Yeah.
How does the model work out for you? Also, at the end of the day, if a surgeon needs to think, I'm aligned with you when you say that surgeons post this model will be incentivized to focus on care so that the hospital doesn't have to take the burden. But for the people who don't get better, do you think it ends up putting a lot of pressure on the doctors? Because now they have to be too focused on outcomes.
Yeah.
And I'm pro that. But does this end up in more physician burnout?
It ends up in more work for the hospital, that's for sure. But at least it will be better planned. Rather than us not knowing what your condition is, what you did in between one visit and the other. And if you suddenly come with a different complication than the one that you came and presented earlier, we would take a lot of tests and medicines, tests and studies to find out why the thing happened. But if we're in continuous contact with you, yes, it's more work. It may not be work for the physician. A lot of this is managed by nurses and care managers. It's work for the organization overall. This thing is hard, which is why nobody does it. And it doesn't make that much money, which is why nobody wants to do it. But we think that this is inevitable for a country like India. This is something some people will definitely prefer as a way. So it is more work, but at least we'll be able to plan people's day much better. Because there'll be a lot of regularity with when you're accessing healthcare.
You briefly spoke about preventive healthcare as well when you were talking about value-based healthcare. What's preventive healthcare?
Normally it is just how people think about, exercise, lose weight, follow up. But for us, it is a series of protocols that we will design around every patient by first taking their full medical history, understanding where they are in their life, and what we expect all the bad things that are going to happen to them. And so then based on that, we will say they need to, if they require any medication, it has to be on a schedule. And we will supply that medication and make sure that they take it. If there are any lifestyle modifications, if they need anything related to stress or mental health or wellness or counseling for fitness or so on, or any physiotherapy, we would also provide that for them and make sure they go through with it. Essentially, if we've taken the risk that anything bad happening to that patient, we are suddenly on the hook for. They may be paying us at the lowest cost plan, they're only paying us 10,000 rupees a year. The highest cost plan, they'll be paying us a lot more. So, with that, a 2 lakh, 10 lakh rupee expense is coming out of our pocket. The person not paying 2 lakh, 10 lakh rupees out of pocket. We have to pay that. So, anything we can do to delay or prevent that from ever happening. That for us is preventative care. We want to prevent the heart attack or any sort of adverse thing.
And how do you get people to buy into that? I mean, while awareness is rising around health and how important health is,
yes,
I'm not sure if it has resulted in a significant increase in the number of people who go for annual checkups.
It hasn't. It's still, I think I'd said earlier, we are generally health avoidant. It's something people prefer not to think about.
Correct.
Nobody wants to think about the bad thing that's going to happen to them. They don't want to think about their family history. They don't want to think about when their parents got diabetes or when their grandfather died. No one wants to think about that. Maybe they think a little bit about it when they get to that age, but by then it's too late. It's one of the great unanswered questions for us, but at least we've committed a significant amount of resources from our company in an effort to try to address it. Because if not this, then there is no hope for the healthcare sector in India. Then we keep spending more and more money. People still keep building more and more hospitals. And people will keep complaining that healthcare is expensive. There's nothing that can be done.
So, for example, if people pay you 10,000 rupees a month, or 10,000 rupees a year, you said.
That's the most basic plan.
Basic plan.
It's catastrophic health insurance we'll be offering.
Okay. So, what's the difference between the basic plan and the highest tier plan?
We just do more. And we cover, like the highest tier plan will be absolutely comprehensive. It covers everything. You don't need to worry.
Okay, so
the
let's
most
say
advanced cancers, the most advanced kidney transplants, whatever it is, we'll take care.
Okay, so let's say I take the highest tier plan and I still end up with some problem because I didn't show up for the annual checkups that Narayana had arranged for me.
That's a very good question. So that forms part of the asterisk.
Okay.
When we get into a contract with someone, this is the agreement that, okay, now I'm responsible for you. I will give you the medication schedule. I will give you the callbacks. I will make sure you are adherent to all the things that are supposed to happen. If you're healthy, that's fine. I'm not going to bug you. I'm just going to bug you every year to say, hi, happy birthday. That's about as much as the contract we need to have. But the more you get into the age bracket where things start happening, where you do need checkups, and if you're non-responsive, then unfortunately we have to kick you out of the group. Because then that means you're not holding up your end of the bargain. Because our end of the bargain is that whatever happens, we take care. At the highest end, whatever happens, we take care. But in order for that to happen, you also need to promise that you will enroll in, certain lifestyle management programs or cut down certain food categories. There will be certain things involved.
So you can also tell people what to eat, how much to eat, and they have to adhere to it.
No, they don't. It's not going to be as strict as that. This is not some, ashram where you only have to follow a certain diet. There'll be things that are absolute things that are red lines. So certain medication, blood thinners, statins, there'll be some things that you have to take. And if you don't take, it does cause severe adverse impacts. So
how do you track whether the person is taking it or not?
We're still developing the protocol.
Okay.
One is we have to rely a lot more on calling and asking if they're done, talk to their family member. But if it turns out that that's not a good proxy, then every 3 months we would actually come to their house and take blood test to see if their vitals are in check.
Because while what you're saying seems to be the most optimized solution for healthcare, not just in India, I mean globally, it's a lot harder to implement it.
It's a lot harder, and it is not that popular in the end, even in the US, where plans like Kaiser have existed since the 1940s. People still overwhelmingly prefer the traditional health insurance, which is I just buy it and it's like catastrophic care. Only when bad things happen is when you take it. No one is taking a more active role in managing health.
The reason this question came up is because Narayana's 90% revenue comes from IPD, but for most hospitals in the West, it's just 60% that comes from IPD. Everything else comes from consultations with the doctor, which is OPD.
Yeah. It's different because for there, seeing a doctor is $1,000. In India, it's 500,000 rupees. So,
But then so is the operational cost as well, right? I mean, the cost of surgery would be drastically higher over there.
yeah. And not as much surgery happens. So yes, a lot more doctor visits happen because we've seen the behavior in the hospital we run in the Cayman Islands. The Cayman Islands is this very small but very, very wealthy country off the coast of Florida. And, you have retired hedge fund managers and bankers and consultants and people that come in and out. So the behavior mimics a lot more of what the American attitude is like. So they tend to visit a doctor with a lot more frequency for a lot more minor complaints. In India, it's still that most people delay. If something's hurting here, no, I won't see, until you can't lift your arm. And then you realize actually you may have had a stroke or so, or something serious would have happened. So yes, people, not only is the cost more, people tend to get checkups a lot more over there. Also because it's covered by insurance. In India, insurance does not cover outpatient care.
And you think having an insurance that covers everything, plus gives you, nudges you for doctor consultations,
Yes.
would solve for that?
Our plan in which the outpatient, if it's done within network, and that we cover that, which will lead to health-seeking behavior, which will lead to lower drawdown of any inpatient care. All three have to work. We have to have people coming in network. We have to have them adhering to the things that they're supposed to do to take care of their health. And thus, it will lead to lower utilization of requirement for surgeries, keeping them healthier and so on. If all three happen, then our system will work.